Good morning, everybody. My name is Caroline. I'm Dr. Caroline. I'm one of the senior residents from Tan Tock Seng Hospital, and currently I'm in a specialty training for geriatric medicine. So today, I'm going to share with you about falls prevention in the elderly. So before I move on to the next slide, I'm going to share the statistic of falls prevalence in the elderly. So in Singapore, about 1/3 of older adults, more than 60 years old, actually has experienced a fall more than once. And each month, about 100 elderly people end up in the hospital. They might actually stay for a week or more because of fall-related injuries. And from 10% of these numbers, they might actually suffer fracture, bone fracture, and some of the 10% of these will suffer head injuries. So why do we need to worry about falls in the older adults? Okay. So I'm going, for the next slides, the next few slides, I'm going to talk about the consequences of falls in the elderly. So the most common consequence that we know of is actually a bone fracture. So in this X-ray, we can see from the this patient actually has a fracture on the left side of the hip, which is a very, very common sight in patients, especially with osteoporosis, because that is actually the fragile side of the bone. The most common treatment for this type of fracture is actually to put in a screw to realign the bone again, as you can see in the picture over here. It's actually considered as a major surgery. However, in our elderly patients, a lot of times they actually have a lot of medical conditions that might actually increase their risk of complications during and after surgery. So sometimes there's a proportion, big proportion of patients who didn't even get to get the surgery. So some of the fractures are actually left untreated. So as I touched on the osteoporosis just now, I just want to talk a bit more about osteoporosis. So osteoporosis is a condition where your bone is very brittle and thin, so that when you fall, even the slightest trauma or fall can actually lead to broken bone. So you can see the picture on the left is actually a normal bone. So and the right side is actually a bone with osteoporosis. So you can see that the left side, the bone is so much denser compared to the one on the right side. So if you actually have osteoporosis or bone that actually looks like the one on the right side, even the smallest, even a simple fall can actually lead to fracture. So sometimes, as I said earlier on, they might not even have surgery to fix the fracture. So in this type of patients, a lot of time they actually suffer a lot of pain. Sometimes it might actually last for weeks, but sometimes it might even last to a few years later on. And after you actually had a fracture, then you actually have a chronic pain. The worst consequences of fall is when older adults actually confine themselves in bed, either due to pain or sometimes it might be because they actually fear that they might fall again. So they actually, a lot of time they tend to, just to stay in bed to prevent them from falling again in the future. So why is immobility or confining yourself in bed is dangerous for you? One of the complications is actually pressure sores. So we actually see this condition quite a lot in patients with who are actually bedbound or confined to their own bed. Sometimes it might actually start as just a redness in the skin, as you can see on the picture on the left. Okay, and after a while, it might actually even take a few weeks or even a few months for it to actually develop to a very bad pressure sore, as you can see on the picture on the right-hand side. So when you actually have a broken skin, like the picture on the right-hand side, it actually provides a site for bacteria to go in and then cause infection. And you will need antibiotic when you develop infection on this type of pressure sore. But to actually treat pressure sore, it's not that easy because the infection will come back again, and as the years goes on, it's going to become more and more difficult to treat the infection. Not just pressure sore is not the only thing that you might have when you are actually bedbound. You also tend to get a lot of recurrent infection, such as pneumonia, urinary tract infection, etc. So when you become bedbound, you will need a lot of help from other people, and it will be quite demoralizing for people who used to be very independent. A lot of time they actually lose their self-esteem, and sometimes they may even become depressed after that. So I'm going to talk about the cause of falls, and I divide it into two parts: your medical conditions and also environmental factors. So I'm going to talk about home environmental factors first. So this is a common problem that we actually find, well, not just in a lot of patients, but probably in our own house as well. We might actually have a lot of clutter in the house or mess in the house that actually occupy a lot of space in the house. So you might actually tend to trip over an object and then you will fall down. The second one is when you don't have adequate lighting in the house, so you can't really see whether there's any hazard around in the house. The next one is when you actually have slippery and uneven surfaces. You might actually have curb that actually separates the inside and outside of the house, and you might have curb going into the toilet itself, and it can be quite tricky, especially if the color of the curb is actually the same as the color of the floor tile as well. So it's actually quite difficult to see. So you might not be able to, step over it. You might actually trip over it. The next one is we actually find this quite common in the house. When you actually have rugs that doesn't have anti-slip at the bottom of the rug. So when you step on it, you might actually, the rug can move with you, so you might actually slip on the rug itself. This is quite common as well. Some of us might actually like to wear slippers because it's quite comfortable, but a lot of the slippers that we find are actually quite loose. They might not even fit properly. And as you can see, the picture on the right side, some patients might actually have foot deformity. So it's actually quite difficult to actually grip the slippers itself, and you might actually trip on the slippers. So sometimes it might even be better if you are actually barefoot. Then I move on to the common medical conditions in the elderly. So I'm going to talk about dementia. So in this picture, it actually shows the brain of patient with very severe Alzheimer's dementia, which is one of the common cause of dementia in Singapore. but there are other causes of dementia as well. Why do patients with dementia tend to fall down? Basically, dementia actually is a condition that affects your memory, but at the same time, it also affects how you judge certain situations. So some patients with dementia might even take a higher risk to actually walk around. They might not even call their family members to help them to walk. They might not even know that slippery floor can make them fall. So a lot of time, it seems that they actually tend to take a very, very high risk in walking. Okay. The next one is Parkinson's disease. So in patients with Parkinson's disease, the limbs, your hands, your arms and your legs will be quite stiff. So a lot of time the way they walk is not normal. So they actually tend to take very short step. We actually call it a shuffling gait. So it's and their balance is not so good as well. So a lot of time they actually tend to fall down as well. And some of them, they might, once they actually start walking, sometimes it will be quite difficult for them to actually stop walking. So they actually tend to fall down as well. The next one is stroke disease, especially in patients who suffer weakness in one part of the body, or sometimes who suffer numbness in one part of the body as well. So as you can see in the picture, this gentleman actually needs help because the right side of the body is actually quite weak. Okay. Then I'm going to talk about some common visual impairment in the elderly. The first one is cataract. So this is a condition where you have clouding of the lens of the eyes, like you can see in the picture on the left-hand side. So you can see the picture on the right-hand side, it's how you actually see an object is actually very blurred generally, so you can't see very well, you can't really see the hazard around you and you tend to fall down. The next one is glaucoma. So in glaucoma, you have increased pressure inside the eye, which will damage the nerves that you have in the eye. And people with glaucoma, they tend to get tunnel vision, where as you can see the picture on the right-hand side, you only, the vision that is preserved is only the one at the center, and you lose the vision around. Then lastly, I'm going to talk about osteoarthritis. In this X-ray, so basically osteoarthritis is a condition where you lose the cushion that separates two bones that are joined together. So it will be very painful to walk. So this is the osteoarthritis of the knees. So as you can imagine, whenever the person walks, it will be very painful to walk. And a lot of time they avoid walking, and they tend to just sit down most of the time because they avoid walking. The next one I'm going to talk about is a condition called sarcopenia. This is quite a new term. So basically, it's a condition where we actually lose our muscle mass as we age. So from the day that you were born until about the age of 30s, you actually, your bone mass actually, basically your bone will grow and then will become denser as well. In about the age of 30 to 40, after that, then you gradually lose your muscle mass. And as you grow even older, at about like 70 or 80, the rate at which you lose your mass is even faster. The thing is, like, there are many factors that can speed up this process. One of it is actually inactive lifestyle, where you don't use your muscle at all. So the thing is, like, you need your muscle to walk, to do your own daily activities. But if you don't use your muscle regularly, you don't train it, then you actually tend to lose muscle even more quickly. So I'm going to emphasize that fall is preventable. Although most of the degenerative diseases that I talk about might not be reversible, but we actually have to compensate by improving on other aspects, such as your physical strength, vision, improving or maintaining your vision, and we should make our environment, home environment safer. So, what do we need to do to improve our physical strength? So you need to have regular exercises, especially the balance and resistance training or the weight-bearing exercises. So what are the weight-bearing exercises? The first one I'm going to talk about is actually hand weights, where you actually you can see it actually can train to the muscles of your arms. The next one is resistance band, which is kind of the same like hand weights. You can actually do a lot of strengthening exercises with it. Okay, and then Tai Chi is a very popular exercises among us. It's a very good exercise because with the Tai Chi movement, you actually you are supposed to transfer your body weight from one side to another. So it actually is very, very good for balance. So it will actually, when you have good balance, then your risk of falling is actually lower as well. Okay. Yoga and Pilates is getting more and more popular in elderly. If you actually search the internet, there are lots of stories of elderly people who actually practice yoga and Pilates, and some of them they might even say that it actually cures their chronic pain or their chronic medical condition as well. However, when you do yoga and Pilates, like you shouldn't do it yourself. You should get a certified trainer to modify the type of yoga or Pilates move that you should do. And obviously, you shouldn't try this at home at all. So moving on from the fancy exercises, is actually brisk walking. So brisk walking is actually is quite cheap type of exercise. You don't need to pay a trainer. You don't need to join classes. So what you need to do is just a pair of legs and maybe just sports shoes as well. So brisk walking, I think most of us who can still walk should actually do this type of exercise. The next one I'm going to talk about is improving your vision. We should have regular eye checkup, especially in patients who actually have certain medical conditions such as diabetes. You should actually get a regular checkup, regular eye checkup, because with diabetes you actually tend to get a lot of complications in the eye, such as cataract and glaucoma. So when you have this condition, it's better to get it detected early, so that whatever treatment that is recommended to you will be able to reverse the damage. Because sometimes when the condition is detected, it might be too late, and the treatment might not even be able to reverse the damage that's already done. And the next one is to actually make sure that your prescription glasses is still appropriate for you, because if you're wearing like glasses of different prescription, then you actually tend to then you might not see very well. Okay. I think later on there will be a talk on by the occupational therapist about how to make your home safer. So I'm just going to talk briefly about it. As we said earlier on, clutters in the house is a common hazard. So obviously we need to remove some of the clutters in the house to provide more space for us to walk. And I talked about lighting before. So this is actually a type of night light that you can actually install. Some of us might might have to go to the toilet quite often at night time, and having a night light will be very, very convenient, because like if you actually like to sleep in the dark, then it's obviously you can't. I mean, it's actually quite difficult for you to go to the main switch to switch on the light. So having the night light switched on all the time might be very good for you. The next one is having grab bars in the bathroom. So this is especially useful if you need to get up from a sitting position if you are sitting in the seated toilet. The next one is to, instead of using the loose rugs, then you actually can use the anti-slip mat like this one. And the next one is actually to wear appropriate footwear. So a good footwear is something that is fitted, that has good cushioning, that has firm base, and we need to make sure that the sole is not slippery as well. So I'm just going to talk a bit about Home Is program, which is the home improvement program for HDB flats to make sure to make the environment more elderly friendly. It's a subsidized program, so but it depends on the flat type that you have. So Is program will actually do some of these things for you. You might actually purchase it like all together, or you might actually purchase individual things like this. Okay. So to find out a bit more about the Is program, you can go to the website itself. Okay. So with this slide, I'm going to conclude my my talk. So I can't emphasize more that falls prevention is possible and is very important in older adults. And simple change in lifestyle, such as exercise, health screening, and home environment change, actually has great impact to maintain the physical function in elderly. Okay. And we will move on to the Q&A session if there's any question.
大家早上好。所以刚才呢，这位医生已经跟我们分享了，就是说，老人家现在就是跌倒的这个现象呢，越来越常见。所以呢，我们应该要怎么样来预防，说就是避免老人家在家中或者是在室外会有这种跌倒的情况。那简单就来说，就是有2个方面。第一个就是说老人家的健康要注重，另外一个就是说我们家中的环境也要注意。那健康方面是怎么样？就是说，因为我们年纪大了以后，我们的骨头会不像我们年轻的时候那么健康，所以就是说我们的密度可能会下降，那就是说我们会有骨质疏松症或者是关节炎。那这对老人家来说，就是说我们在行动方面或者是行走会有一些不方便，可能说走路的时候就没有办法走得很稳。那其他方面就是视力方面的问题，因为我们年纪大了以后，我们的眼睛更容易就是会老化，所以我们会面临像是白内障或者是青光眼的问题。那可能就会影响说我们的视线，然后我们走路的时候就没有办法注意到我们周遭的环境。那连带的呢，就是说我们家中的环境也要注意，就是说我们不能说家中堆放太多的杂物，或者是说我们如果家中有地毯啊，还是我们的地板不平，我们应该想办法去做防滑，或者是我们安装一些扶手，来帮助老人家，让他们在行走的时候有东西可以依靠，就是走路可以走得比较稳。那简单来说，就是老人家在跌倒这个方面，我们是应该尽可能的去预防，因为年纪大了以后，如果你跌倒的话，你受伤，那复原是很不容易的一件事情。对，那现在医生还会在这边跟我们一段时间，所以如果各位有什么问题要问的话，可以就是现在提问。有吗？像是如果你们对你们的身体的保健有什么疑问啊，还是对家中的环境如何改善啊，还是政府对这一方面有什么津贴、有什么补助这一方面的问题？有。
Hello， 医生，我想问哦，好像跌倒啊，以后会怎样吗？那个骨头有一点裂，以后还会发作，会什么吗？
After falling down, what will happen if the bone fractures?
What will help the bone fracture?
What will happen if the bone fractures?
If the bone
Yeah,
fractures.
so what will happen to their life afterwards,
life
after the
afterwards.
fracturing? Just say. I will just.
The question is about what will happen after you actually have a fractured bone. Actually, it depends on what type of fracture, on where the site of fracture is. It should be assessed by the doctor. A lot of time we actually ask the bone specialist to see whether this is something that needs to be fixed by surgery or not, because sometimes it might not even need surgery at all. If it actually happens on the hip, if it's really bad, they will actually recommend for you to go for the surgery. Mainly is to align the bone again, and at the same time, it also helps with the pain management as well.
OK， 刚才医生他说，如果你有骨折，就是跌倒然后导致骨折的这个现象的话，那我们建议是说你要先去请一位骨科的专科医生去帮你做检查。那检查的过程，如果发现你的骨折是轻微的话，那你可能就不用开刀，只需要做简单的复健。但是如果你的骨折的情况很严重的话，那要看说你骨折的部位是在什么地方。那个骨科医生会依照你的情况去建议你做相对应的开刀的手术，然后这样子可以帮助你的复原，然后你以后在行走的时候就比较不会遇到那么多的困难。这样子可以吗？
可以，谢谢。
Is there any way that can improve the bone intensity of a person to prevent other sort of disease?
I think you are referring to osteoporosis, how we can actually prevent osteoporosis. So there are causes of osteoporosis. I actually divide them into two. One is actually your own condition, your own physical condition, such as that we actually find osteoporosis is higher in patients who are, well, I mean, if you are female, in postmenopausal age, you tend to get osteoporosis mainly because your hormone actually gets lowered after you go into postmenopausal state. The other condition that increase your risk of having osteoporosis is when you take medication, such as steroids, and there are other conditions as well that increase your risk of getting osteoporosis, such as if you have malabsorption condition, rheumatoid arthritis, and some hormonal diseases as well. But the second risk factors that you can modify is actually to change your lifestyle, because we know that patients who smoke cigarettes, who doesn't exercise, who tend to live a sedentary lifestyle, who actually drink alcohol, they actually tend to get a lower bone density, or they might actually have osteoporosis. Therefore, as much as possible, we should modify the risks that is modifiable, such as living a healthy lifestyle, such as doing exercise, stopping smoking, reducing your alcohol intake as well. And the last thing I forgot to mention is actually your food as well, your food intake. You should actually increase your intake for calcium and vitamin D. So what are the diet that is actually rich in calcium and vitamin D? Those are actually dairy products such as yogurt, milk and cheese, and some fatty fish like mackerel, salmon is actually quite high in calcium and vitamin D as well. But nowadays, like even fruit juice, a lot of them, they're actually fortified with calcium as well. So I hope that actually answers your question.
Beside that, I understand that for elderly to take cheese, it's not so digestible. Is it advisable for elderly to take cheese?
It's not advisable, is it?
Yeah. I understand. Cheese.
Okay, I think generally it's okay for you to take cheese. The thing that you need to worry about is actually the soft cheese, the unpasteurized cheese, basically because it's unpasteurized, which means that some bacteria might live on it. So, but in general, cheese should be quite good in elderly because of the calcium content.
Okay, thanks.
OK， 刚才那位老先生他提的问题是说，我们一般人应该要怎么做才可以提高我们的骨头的密度 ？OK， 骨头的密度就是说我们的骨头怎么样才可以比较硬啦 ？OK， 所以因为老人家比较会有骨质疏松症的问题，那我们要怎么样去改善这个情况？然后骨质疏松症它导致骨质疏松症的原因有2种，一种是你生理方面的，一种是你的生活习惯。那你的生理方面的话，医生是说，就是通常是女性在过了更年期以后，那她可能因为荷尔蒙的关系或者是雌性激素的关系，会导致她骨头的密度下降。那这个是没办法避免的。另外一个就是说，如果你有服用类固醇的药物，或者是其他的一些在控制其他疾病的药物，那可能也会导致你的骨头的密度有下降。那这些我们是没有办法避免，但是可以避免的可以改善的方面就是我们的生活习惯。那就是说，我们不要尽量不要抽烟，不要喝酒。然后我们的一般的饮食的时候，我们要多摄取一些富有钙质或者是富有维他命、维生素 D 的一些食物。那这一类食物有什么呢？就像是说鱼啦，还是一些乳制品啦，像是牛奶，还是一些乳酪 cheese。那后来那位老先生有提到说，是不是说老人家比较不适合去吃一些像是乳酪这一方面 cheese 的这些食品？但是医生是说，只要你吃的那些 cheese 是有杀菌过的，那就还可以，对老人家是有益的，就是尽量不要吃没有杀菌的乳酪乳制品，这样子就可以提高你的骨头的那个密度。
医生你好，我想请问你哦，躺着睡觉没有问题，侧睡左手边关节上端会突然间很痛。
关节是手的关节还是脚的关节？
手臂上面。
哦 ，OK. She's saying that when she sleep lying down, like facing the ceiling, she's okay. But when she sleeps sideways, then this part upper limb will have a very sharp pain. Yeah, above the joint. Yeah, so she's wondering what's the issue.
Oh, okay.
Yeah.
So the question is that this lady is experiencing some discomfort whenever she actually lies on the right side, but she's okay when she actually lies facing up. So I can't really answer this question. She should actually go to the doctor and get examined as well, because there are so many so many different causes that actually can cause this. Sometimes it might be just a simple thing like maybe just she might actually she might actually knock that side of the body, and then that actually cause some maybe bruising on the right side of the body, and then when she actually press on it, then it might actually cause some pain. But there are other different explanations as well. So I suggest when you have this type of symptoms, you should go to the doctor and get it checked.
OK， 医生是说，因为导致这种情况或者是这种现象的原因有很多，那他现在没有办法很准确的告诉你一个原因是什么，那就是建议你说，希望去找医生做详细的检查，然后看那个原因到底是出在哪里才可以解决。
Okay, we have one last question here.
可以，谢谢你，医生。
谢谢。
请问那白内障跟青光眼，白内障跟那个请问白内障和青光眼，会不会很容易瞎？还是可以医吗？现在有这个科学医吗？
She's asking cataract and glaucoma. Is it very prone to lead to blindness?
Yes.
for now? And is it the preventive measures like operation? Is it very accessible now?
So the question is whether cataract and glaucoma, whether it can lead to blindness. Yes, it can lead to blindness. Therefore, it is better to get it checked as early as possible, because sometimes if it's too late, then we might not even be able to reverse the damage, like blindness, which is actually the most serious condition if you actually have glaucoma and cataract.
So the operations, is it widely available?
Yes, operation is available for these conditions, but it needs to be, it should be done quite early on. So we shouldn't wait until it's too severe.
OK， 医生说，青光眼跟白内障的确是有可能会导致失明的情况。那一般来说，建议就是说，我们尽早去找医生治疗。然后，如果是早期发现的话，那我们开刀来治疗这个白内障跟青光眼的成功的几率就会很高。但是如果你到后期的话，那可能就是情况会比较复杂。所以如果你发现你有青光眼或者是白内障的这个现象的嘛，那就是请你尽早去医院做检查。这样子。谢谢。